Today, ladies and gentlemen, good evening. My name is Andy Wheeler from I-94.
And I'm Vanessa Malumai, co-host of the Malfunction Show, also on I-94.
Now, the Non-Communicable Disease Consortium is comprised of over 200 individuals and over 24 government agencies. It was established to reduce the burden of non-communicable diseases such as heart disease, stroke, cancer, diabetes, and asthma.
Our next honoree is not only a leader in the NCD Consortium, but also the program coordinator for the Diabetes Prevention Program at the Department of Public Health and is board member with the Guam Diabetes Association.
So congratulations to the KUAM Care Force Health and Wellness Award recipient, Mr. Patrick Lucis.
The NCD Consortium, I think it was a blessing in disguise. In the department, for so many years, we've been running in silos, and what that means is the diabetes program would do their own thing, the cancer program would do their own thing, the tobacco would do their own thing. Today, with the NCD Consortium, we've been running for about maybe 4 years now. It brought everybody to the table. Bring all your different NCD grants and programs, and let's sit down and how is it that we can work efficiently and strategically so that we're not duplicating services, but we're actually leveraging our resources so that we're able to concentrate our efforts on where we need to put our focus in. Diabetes is very serious, especially nowadays with the current data that we're seeing out of the Department of Public Health and Social Services. In the last 10 years, we were averaging about a 10%. That's 1 in every 10 person with diabetes. Our numbers in 2013 actually just jumped up to 14%. And so we're almost seeing maybe almost 2 out of every 10. And the most alarming thing is that we're seeing it hit our youth at a very young age. We're seeing them with diabetes. The youngest that we have diagnosed with type 2 diabetes is 5 years old. So we're getting younger, and it's timing with the obesity rates, and so it's a very serious matter that we're seeing here in Guam. Both my parents have diabetes, and my dad is actually a champion of controlling his diabetes for over 40 years now. And so when I was getting into the job, I said, you know what, I think I can offer more to help in our community in reducing this disease. It was a learning experience for me, but right now it's all passion, running at 90 miles an hour, and I just want to see our community, especially our young generation, get healthy and not get sick. The numbers are just looking really bad, and so my passion is really there to help a lot of our community prevent the diseases. I really do want to say one last important message, and we really need to work as a family, as a community. We cannot just address the disease individually. It's very important that that everybody in the family contributes to addressing NCDs, where we live, where we work, where we learn, where we play, and where we practice our faith. And so making that little change, that small step, makes big rewards. And so I'm hoping that our community can do their part in addressing NCDs so that we don't have to face this burden of diabetes and cancer that affects many of our families. And so, live healthy, Guam.
Once again, ladies and gentlemen, your Health and Wellness Award recipient, Mr. Patrick Lucis.
Thank you. This reward really goes out to a lot who took a part in this. First of all, I really want to thank the KUAM Care Force and judges for choosing me for this Health and Wellness Award. I believe this award really goes out to a lot of many of our community members who who are champions actually for health in our community. This line of work requires beyond the hours of 8 to 5. I'm on conference calls at 4, 5, 6 o'clock in the morning. We work beyond the hours of 5, and especially on the weekends. I work with many of you here. I work with many of you here. And so it takes a lot of sacrifice, takes a lot of time away from our families. And so I really want to give thanks to my family for their support and patience. My partner, beautiful partner, Linda De Rosario. My mom and dad, who is out here, Johnny and Ida Lucis. My siblings, Lawrence, Danny, Tony, Belle, Darlene, and Grace. And the rest of my families who are here, I really want to thank them. They are the ones who are also part of the sacrifice. This award would really not be possible. Really want to give big thanks to my boss, Rosalie Zabala. She's kind of like our captain of the ship, and along with what I call our A-team at the Bureau of Community Health Services. And I do want to mention and call out to some of them. Alex Severio, Chuck and Lola Tanner, Alyssa and Kanko, Ben and Manil, Elizabeth Guerrero, Lawrence Alam. These are my teams over at the Bureau of Community Health Services in really addressing NCDs, heart disease, stroke, cancer, and diabetes. As you heard earlier, we are very blessed to have the NCD Consortium made up over 200 partners, community members from the government, the private, from the faith-based community, and the non-government organizations. We've just received a overwhelming response from the community to really reach out to our community and reduce overweight, obesity, and these diseases that are affecting our young generation. We see a lot of our kids in their 20s, and they're going through dialysis, getting blind because of diabetes. Our overweight and obese rates are really increasing. So there is a lot to do in there to reduce diabetes. I really want to give thanks to our Heavenly Father, who I've always, as my folks have disciplined us to always keep God in our prayers. And every day I ask Him to give me the strength and the courage and to use me as an inspiration to really reach out to many of our community members and to touch the hearts of our members to really make the healthy choice the easier choice, whether it be choosing a healthy meal for our kids and our families, or whether it be taking a walk with a family. These simple things are the simple things that can actually reduce the burden that we're seeing here on Guam. In the Worksite Wellness program, one of the other things that we've been very successful with is that we have 104 health coaches at our over 52 government agencies. And so this is for you folks. I really want to thank all those that have contributed to this accomplishment. Again, I really want to share this with all of you, and I hope to see you up here someday. So one message to you, all of you again at home, make the healthy choice.